Myofunctional Therapy in Snoring and Sleep Apnea. Oropharyngeal Exercises and Sleep Disordered Breathing. Edited by Carlos O'Connor Reina and published in 2026 by Springer Nature Switzerland, is not a conventional dental textbook. The editor is an otolaryngologist, and the book is a multidisciplinary work situated at the intersection of sleep medicine, otolaryngology, orofacial myofunctional therapy, orthodontics, and dental sleep medicine. It is intended for a multidisciplinary audience that includes sleep medicine physicians, otolaryngologists, speech-language pathologists, myofunctional therapists, dentists, and orthodontists. The book attempts to address an important question: can the identification and treatment of functional disorders of the tongue, lips, oropharynx, and breathing improve outcomes in snoring and obstructive sleep apnea, either as a standalone intervention or as an adjunct to established therapies? For dentists, the subject is relevant because of craniofacial risk factors, oral appliances, and tongue function, but the book does not provide a basis for dentists to independently assume responsibility for the medical diagnosis of obstructive sleep apnea. The work is divided into 3 parts and 21 chapters. The first part addresses the history, epidemiology, pathogenesis, phenotypes, and treatment adherence. The second moves on to anatomy, breathing, clinical assessment, the lingual frenulum, sleep studies, drug-induced sleep endoscopy, ultrasonography, tongue function, and pediatric cases. The third examines the combination of myofunctional therapy with continuous positive airway pressure, oral appliances, and surgery, as well as passive and primary use in selected patients. This structure guides the reader from pathophysiology and diagnosis to therapeutic decision-making. The scientific foundation is substantial but inconsistent. The authors use randomized controlled trials, systematic reviews, meta-analyses, clinical guidelines, consensus documents, observational and pilot studies, as well as clinical experience. The introductory chapter presents reviews that generally report reductions in the apnea-hypopnea index, daytime sleepiness, and snoring, but also identify protocol heterogeneity, small sample sizes, and short follow-up periods. In some sections, the therapy is described as validated, revolutionary, or as a standalone treatment, whereas other chapters acknowledge that major international guidelines have not yet incorporated myofunctional therapy into standard recommendations and that long-term randomized trials are lacking. The book itself specifically identifies the lack of standardized protocols, objective diagnostic criteria, and long-term research. Independent literature supports a possible benefit, particularly in adults, but does not justify presenting the therapy as a universal replacement for established treatment modalities. A meta-analysis from 2024, based on 7 randomized controlled trials involving 310 patients, demonstrated improvements in the apnea-hypopnea index, daytime sleepiness, sleep quality, and minimum oxygen saturation in adults, whereas the evidence in children was limited and accompanied by poor adherence. A more recent overview of systematic reviews reported benefit in adults, but rated the methodological quality of most reviews as low or critically low, while a network meta-analysis from 2025 did not demonstrate a statistically significant overall reduction in the apnea-hypopnea index. The most defensible conclusion, according to the author, is that myofunctional therapy represents a promising adjunctive treatment in appropriately selected patients. An important recommendation is that patient selection should not be based solely on the severity of sleep apnea, but also on phenotype and functional impairment. In mild to moderate disease with a pronounced functional component, the therapy may be more appropriate, whereas severe disease and major anatomical obstruction generally require a combination of treatment modalities. The rationale is reasonable, but there are still insufficient validated criteria to reliably predict treatment response. A second important recommendation is the objective assessment of tongue function. The book emphasizes that tongue posture, mobility, strength, and, where possible, endurance should be assessed before exercises are prescribed. An independent systematic review from 2024 confirms reduced tongue elevation strength and endurance in adults with obstructive sleep apnea, but also identifies insufficient high-quality evidence regarding the extent to which therapy modifies these parameters. Of particular relevance to dentists is the recommendation concerning mandibular advancement devices. The author proposes combining mechanical enlargement of the upper airway with functional rehabilitation when residual snoring, mouth breathing, or orofacial dysfunction persists. However, the evidence supporting mandibular advancement devices themselves is considerably stronger than the evidence demonstrating additional benefit from combining them with myofunctional therapy. The combination should therefore be regarded as an individualized option rather than a new standard of care. A particularly important and controversial issue is the lingual frenulum. The book states that the consensus of the American Academy of Otolaryngology head and neck surgery did not find sufficient evidence that ankyloglossia causes obstructive sleep apnea. It also cites a more recent meta-analysis that identified an association, although 5 of the 6 included studies diagnosed sleep apnea using questionnaires, which substantially limits the strength of the conclusions. For this reason, the recommendation to consider frenotomy as an adjunct to myofunctional therapy should be interpreted cautiously. Restricted tongue mobility may make exercises more difficult, but this is not equivalent to evidence that frenotomy treats or prevents obstructive sleep apnea. It is important that the book describes serious complications of frenotomy and acknowledges that there is no evidence demonstrating the superiority of laser techniques over conventional methods. The diagnostic chapter identifies polysomnography as the reference diagnostic method and respiratory polygraphy as an important alternative in appropriate clinical circumstances. Questionnaires and consumer devices may be useful for screening, but they are not equivalent to a confirmed medical diagnosis. This is a particularly important message for dentists. Their role in identifying patients at risk can be highly significant, but screening is not the same as establishing a diagnosis. Drug-induced sleep endoscopy may assist in identifying the site of upper airway collapse, whereas ultrasonography is interesting but remains insufficiently validated for routine dental decision-making. The 4 greatest strengths of the book are its interdisciplinary approach, linking dentistry with sleep medicine and otolaryngology, its detailed functional assessment, which moves therapy away from generic exercise programs toward a phenotype-guided approach, its broad and current literature base, with references extending through 2025, and its serious consideration of treatment adherence, without which a therapy based on daily exercises has little practical value. The chapters addressing the Buteyko method, mouth taping during sleep, passive myofunctional appliances, and prevention of sleep apnea in children contain interesting concepts, but in some places they cross the boundary between a reasonable hypothesis and a sufficiently evidence-based recommendation. Particular attention should be paid to the disclosed conflicts of interest. The author of the chapter on breathing exercises states that he is the inventor of a product recommended in the chapter and the owner of an associated program, while the section on passive myofunctional therapy discloses relationships between authors, specific devices, and industry sponsorship. This does not demonstrate that the conclusions are incorrect, but it does require more rigorous scrutiny of the claims and greater reliance on independent clinical studies. For dental students, the book is advanced supplementary reading rather than a primary textbook. Dentists involved in oral appliance therapy, orthodontists, residents in specialty training, and clinicians working in sleep medicine are likely to benefit most. For the general dental practitioner, it is useful for recognizing patients at risk and understanding the limits of the dentist's role. For specialists and university faculty members, it provides a valuable reference and educational overview, but it does not replace clinical guidelines or primary scientific literature. 3 key professional concepts are worth retaining. First, obstructive sleep apnea is not solely an anatomical disorder, and in some patients muscle function and breathing pattern may be therapeutically relevant. Second, myofunctional therapy should be prescribed following a functional assessment and accompanied by objective monitoring rather than applied as the same standardized set of exercises to every patient. Third, dental intervention has the greatest value when it forms part of a multidisciplinary treatment plan rather than attempting to reduce a complex disease to tongue posture. the lingual frenulum, or a single oral appliance. Does the book deserve a place in a professional library? For dentists seriously involved in snoring management, oral appliance therapy, orthodontics, or sleep-disordered breathing, yes. A clinician who does not work in this area can reasonably skip it. Its greatest value lies in its systematic treatment of the functional component of obstructive sleep apnea. Its greatest weakness is that the author's enthusiasm occasionally exceeds the strength of the available evidence. It is best regarded as a multidisciplinary reference manual and supplementary clinical resource rather than as a guideline or a standalone treatment protocol. Is it worth the time?